Hey guys, I'm Dr. Katranji from the Katranji Hand Center and the Katranji Reconstructive Surgery Institute. Thanks for checking out this video. This video is really important because it's the most common and at times the most frustrating situation when you have surgery. What do I do after the surgery? Post-operative instructions, because you're going to get instructions from the doctor, from your therapist, from the nurses, and from friends. And also don't forget Dr. Google, because Dr. Google always has an opinion. The most important thing to understand is there are 5 basic elements after surgery that we're looking out for. Now, we're not talking about recovering from your surgery. We're not talking about what type of surgery you had. We're just talking the biology of surgery, which means things that happen if you do or operate anywhere. Number 1, there's going to be swelling. Number 2, usually there's going to be some form of incision. Number 3 is there's always going to be some form of stiffness to the area. Number 4, there's always going to be some form of redness or warmth to the area. And number 5, and most scary, pain, right? We're always worried about pain. And the big thing is that when we have surgery, we're often having surgery for something that's causing us pain. Now you're having surgery that causes pain. You're like, why did I have the surgery to begin with if that's going to happen? So it's going to be really important that we're going to just kind of work on instructions for each one. Let's start with the swelling. Anytime anything happens that's traumatic or stressful to the body, what happens? It swells. So for instance, you're playing basketball, you're having a great, fantastic game. At the end of the game, you feel exhausted, your muscles feel swollen, achy, and tender. What do? You get a massage. Why? Because the muscles are swelling. We all have seen those commercials with the football player after playing football. They're in one of those little kind of baskets of ice. It's an ice bath, really to cool their body down, to get the swelling down. Swelling is a very common thing that happens. Now, did you notice what I said? What are these players doing? What are these athletes doing? What are these professionals doing? They're massaging the tissues, not just simply touching it, but they're actually kneading the tissues. They're rubbing it down. So they're working with the tissue to kind of get that swelling, to get the blood flow stimulated, to move it out of there. The ice bath helps a lot. Why? Because especially in the first 24 hours to the first 36 hours, the ice actually shuts down those small little blood vessels, reduces the access of those little messengers to slow down the process and regulate it better. So that's how ice helps. Now, ironically, after 3 days, what helps with the swelling is actually a warm pad. It's like the exact opposite. So the warmth actually helps open up the blood vessels to the skin. It actually helps stimulate and bring in more good blood. It also helps the drainage recycle itself. So we have 3 systems. The cold in the beginning helps with the capillary. The warmth 2 or 3 days later helps with the transition between the capillary and the blood vessels to open things up a little bit. Both help the lymphatics kind of do their job, right? The drain system and the massage. The massage, really important. Now again, a lot of people are like, oh doctor, I am massaging it. This is not massaging it. This is rubbing it. This is not a genie. There's no magic lamp coming here. You need to massage it, right? You don't rub the dough. You knead the dough, right? To make it into this flavorful bread. The same thing. You need to knead the tissue. Now obviously, if you're not sure how hard you need to go, either ask your doctor or ask your occupational therapist or ask your physical therapist. All of these people can help provide instructions for you to learn what to do after surgery to massage the tissues. Nothing wrong with also asking a chiropractor, a massage therapist, and any other expert that's licensed to give this kind of advice. Now with the swelling, it's also about redness. The redness comes on. If there's going to be more blood to an area, if there's going to be more inflammation, the tissues need to be healed, right? Then the area is going to get red. Basically any process, anything we do, even everyday stuff, even when you brush your teeth, creates something called inflammation. Anytime there's any friction, rub, motion transition, the tissues get stimulated to swell up. Now, after surgery, that's a lot of stimulus. So it starts swelling, it starts getting inflamed, the surrounding tissue gets red. The red is usually kind of a purpley red. It's not quite, scary red, but cellulitis or infection is actually bright red. And also, when you have that purpley red swelling and you press on it, we're looking for something called capillary refill. So capillary refill is very easy to see. If you press on your fingertip and it blanches and it turns white and then you let go and it becomes red again, that's your capillaries. That's the delivery of the blood flow. And we actually want the capillary refill to be pretty quick. quick, pretty brisk, but we don't want it lightning fast. We want about a second, maybe 2 seconds. But if you press on it and it becomes red again, and it's kind of angry and it's inflamed and it's kind of creeping up on your hand, that's cellulitis. That's an infection, and you need to call your doctor or you need to call the hospital. So really, really important about inflammation. So inflammation's okay. Swelling, redness is okay. We just don't want that creepy redness. Now, obviously, there's something now called the wound. And the surgical wounds come in 2 varieties. 1, the closed variety. 2, the open variety. Of course, you can have small incisions, little incisions, big incisions, deep incisions, but we're saying that, hey, look, what if I have staples, sutures, stitches, or tape, or glue? That's one thing. The wound is closed. That basically means is the doctor, the staff, the nurse practitioner, the physician assistant, whoever closed that wound was confident enough that the area was clean enough, the area was washed out enough, and it was stable enough that we could close it, and likely this wound will heal. And that's actually for the majority of wounds. The incision that's closed, if it's closed, we want to take care and make sure those sutures are clean. Now, a lot of people tell me, yes, doctor, I'm putting peroxide on it every single day. Don't use peroxide. That doesn't help. Peroxide actually helps kill bacteria, but it also kills other things, including cells. Just use gentle soap, gentle water. And in the first couple of days, you can just spray, like, take a spray bottle, spray just saline. Contact lens solution works really great. Every day, distilled water works great. Even just simple water by itself, and then just kind of clean up around the wound. Now, after 3 days, a lot of times there's this really cool thing called epithelialization happen. So whether the wound is this gigantic wound in your chest or a small wound in the palm of your hand, these little cells, the epithelial cells, the cells that make up the top of our skin, they migrate, they creep, and they get into an area where they actually cause the wound to cover up. And basically, all that epithelialization means waterproofing. That's what's really cool. Once the epithelialization occurs, it doesn't matter if you can see a beating heart. If you see that layer of epithelial tissue, you can actually go into the shower just fine. Now remember, the shower, not the bath. Running water washes out the tissues, whereas standing water very often is stagnant, and things may have multiplied there that we didn't have any control over, even bath water. So usually 3 days, some people will tell you 5 days after the surgery, you can get a wound wet, especially like a closed wound. So the cool thing is that if you have glue to close a wound, usually you can get it wet and shower 24 hours after the closure. But again, if you're not sure, 3 days is a great rule of thumb. If you're really, really not sure, after 5 days, you're fine. So that's what the closed wound. With the open wounds, that's where it gets a little bit more complicated. Here's the key thing. It's very tough in this video to discuss everything with an open wound, but the most important thing about an open wound is we want to keep it moist. We don't want it to dry out, but we don't want it where it's so sloppy wet. So the key thing about that is we're always going to try to put material into a wound that does one of 3 things. Number 1, keep the moisture barrier there, just kind of like oil of Olay, which, by the way, this is not a promotion of oil of Olay. They're not paying me for this video or anything like that. But if you want to pay me oil of Olay, I'm here, okay? But just kidding. The point of the matter is you're moisturizing the tissue. Usually petroleum jelly is perfect. It looks great. Vaseline, like the clear stuff, not the flavored stuff or the scented stuff, just the Vaseline. Now, a lot of times we'll actually add a little chemical to it, and we call it a triple antibiotic ointment or Neosporin ointment. Again, not creams, a petroleum-based, and that thing will help keep the moisture barrier there. So that's really important. Number 2, with an open wound, we sometimes put a material like I just mentioned to help it fight any infection. Believe it or not, we use silver, which is really good. We use antibiotics, which is also good. We actually, believe it or not, use honey sometimes. So honey is also another great thing to help fight infection. So in an open wound, you see it, you don't see it like, you see it open, you see stuff in there, you're like, how is this going to close? But if you look at that wound 2 or 3 days later, you start noticing these little red bumps that seem to be building up inside the wound. That's a great sign. That means there's blood flow that's coming in there. And if blood flow is coming in there, then that wound is going to close. Now, mind you, we talked about infection earlier, inflammation earlier. We talked about wounds. What's going to be the enemy that allows bacteria to multiply and at the same time not let that blood flow to develop? Smoking. Don't smoke. See previous videos and our website. Everywhere you see, I say, please don't smoke. I don't care what you smoke, just don't smoke. It's the smoke that's the problem, okay? So now we've covered a lot of those things. Again, an open wound is like a closed wound, okay? In that after 3 to 5 days, you get the epithelialization. You'll actually see this kind of shiny, waxy covering on it. And that's literally the upper layer of your skin, the epithelium, creeping into the wound, covering it up, and making it waterproof. And they kind of overlap. The big thing we always worry about is pain. Here's the one rule. If I have to do anything to you, it's going to be painful. So when we numb up the tissue, I'm usually using a combination of something called Lidocaine and Benzocaine, and those two together make it 4 times more powerful. So each one alone isn't really strong, but together 4 times more powerful. So that way it lasts up to 8 hours. And what we're going to do is give you something called Toradol during this period of time. So you're going to get this numbing medication that will numb up the area. You're also going to get Toradol, which is like a cousin of Motrin, but we can give it in the IV. Very effective to reduce inflammation. And those two together are really, really powerful. And usually the anesthesiologist will also give you something like morphine or Demerol or something else to help also control the pain, but really a small amount for just a short period of time. Now, what will happen is the first few hours, you're like, man, this feels fantastic. I've never had a better sleep in my life. I've never felt better in my life after waking up from anesthesia. Now what will happen is you'll be sitting there watching the football game, getting ready to watch Michigan State beat Ohio State. You're going to be really, really excited. You're going to be so chill, and then all of a sudden you feel like somebody just kicked you in the hand. You're like, ah, this hurts so bad. What happens is, like when you go to the dentist, numbing medication, 1 minute works, 1 minute just stops working. It's not a slow transition. So what we tell people is about 2 to 3 hours after your surgery, take a Motrin, all right, like 600 milligrams of Motrin or 800 milligrams of Motrin. Motrin also goes by names like Advil and ibuprofen. The ibuprofen is also an anti-inflammatory to help reduce inflammation. It'll help reduce swelling. It'll help reduce the painful stuff. It'll make the ice work or the heat work when you take it. It also doesn't cause so much severe clotting, which improves the blood flow, which helps things cycle out, as well as it controls pain really, really effectively. And you want to take one of that every 6 hours for the next 5 days. So 600 or 800 milligrams of Motrin every 6 hours for the next 5 days. Now for the next 3 days after surgery, you want to alternate the Motrin with either Tylenol number 3 or Norco, depending on your doctor. That really helps control your pain. That really kind of brings it under control. But another thing that also helps, obviously, is to elevate, to reduce the pressure, ice, massage, all the stuff that we talked about earlier. So really important, and also calming techniques to be as calm as possible. Keeping a splint out if you have to have a splint. And if you need to, just making sure that a lot of times they tell you keep it above your heart. You don't have to be like this. You're not raising your hand in class, okay? You just need to make sure that it's like this. So if you're on a couch and you're sitting down, this is perfectly fine, okay? If you're like this and it's kind of like that, don't panic. Just bring it up a little bit, okay? But it's really important not to, you don't want it hang like this because then all the pressure and flow goes down in there. So it's all about balance. So you can see that these are the techniques that we can do post-operatively to help control pain, how to address pain, the steps we take to manage the pain, and what to do. Again, this is not a comprehensive video. It's not covering every single thing, but hopefully I've covered enough of the big things so that you feel more confident, so that when you need to call us, at least you've tried all those things when you call us. If you're really worried and you're really panicked, call us. Don't hesitate. And if we're not available and you're really worried and you think it's an emergency, either go to the emergency room or the urgent care or call 911. So really, really important here. Communication, like we've seen in other videos, a vital pillar to successful surgery and successful outcome. Really happy you took the time to listen to this video. Hopefully you were a little bit entertained, because I know some of this material can be dry. And looking forward to talking to you soon. Good luck, good surgery.